Mayor, again, I thank you for your willingness to meet with this group. Again, this was a group that had started before my tenure under Carolyn Graham, but a group who has worked diligently on these issues and prepared a report, and finally we've come to the day where they can formally make a presentation of report to you. And you've got to your left Dr. Ferguson, who was the co-chair of this of your commission, and I'll let her introduce herself, and then maybe the commission members can introduce themselves, and then we'll proceed.
Well, it's a pleasure for me to be here with you. I feel like I'm home always with Mayor Jones. Mayor Jones and I have been working for women and children's rights and issues and good health care as long as I can remember. Yes, exactly, but we need the money though. But but this is a fantastic group of people that we brought together from every sector of Richmond, every health system, school systems, community-based organizations, lactation consultants, physicians, nurses, doulas, perinatal educators, the whole gamut. And so we're just happy to be here today to really talk to you about an issue that is dear to our hearts and to present to you our report. I'd like to also thank, she's not with us today, but Doris Mosley, who was the co-chair. And I'd like to thank Rose and her team, and Carla. Where's Carla? We've worked tirelessly on this for 2 years. And so without further ado, I think if it's okay with you, I would like to just get everybody to just say their names. Absolutely. And go around the table. I bring you greetings from the World Health Organization and the International Council of Nurses in Geneva, Switzerland. I'm on holiday. I drove from the Outer Banks in my house to be with you today, and I'm going to hang out with my nieces and nephew, and then drive right back.
Well, that's all right if you take us with you.
Yeah. To my left.
Sulola Adepoye, lead physician from the Richmond City Health District, and I provide consultation to the mental care services at Richmond Health District.
And I'm Rose Singleton. I'm the program manager for the Richmond Healthy Start Initiative to reduce infant mortality in the city, as well as the city's early childhood development initiative.
Valerie Coleman, I'm from DCU Health System, and we are actively pursuing the baby-friendly hospital designation.
I'm Denise DeChico. I'm the Lactation Services Coordinator for Henrica Doctors Hospital.
I'm Leslie Lytle. I was a member of the Breastfeeding Commission, and I'm now coordinating a grant to promote breastfeeding and physical activity as means to reduce childhood obesity for the city.
Blake Slusser. I am the Women's and Children's Education Manager for Bond Support Virginia.
I'm Chris Bennett. I'm the controller over at the Greater Richmond Chamber.
One of the few men here.
I'm Monica Tinsley. I'm a breastfeeding peer counselor for the WIC office.
I'm Lorinda Davis. I'm nursing supervisor over reproductive health at Richmond City Health District. And as a part of Health and Stock Consortium, I sit on fetal infant mortality reviews.
Suzette Denislow, I'm the Mayor's Chief of Staff.
Steve Harms, the interim deputy for human services.
I'm Gari Galati. I'm a pediatrician and lactation consultant for the Children's Hospital.
Very good.
Myra Lawrence, Richmond Healthy Start Community Liaison, Carla Childs, Human Services.
And I think everybody else is your team.
And they're all mine.
Yeah. And one more colleague. We're just introducing ourselves. If you could say your name and where you're from.
Wow. I'm April. I am a professional doula. I'm also a nursing student working on becoming a midwife. And I hope they're and breastfeeding.
Okay, so what we're going to do now, with your permission, Mayor Jones, we're going to do a presentation for you real quickly. And so Rose and I are going to do a tag team with our committee members. And we'll get Carla. We probably can advance ourselves. So you already know who I am. When I started out working on the commission, I also was the director of the community nursing organization for the Virginia Commonwealth University. I just finished 5 years of my life helping them out on just a very part-time basis because I have to travel to like 40 countries a year. So Richmond became a quick stop for me. But what I loved about what the community nursing organization was able to do was to work with Richmond City Health District and RRHA to really build partnerships in the Mosby, Creighton Court, Hillside, Fairfield, and Wickham resource centers to provide services for our citizens in Richmond there. It is a fabulous partnership, and a lot of our colleagues around the table, it's also an opportunity for us to do breastfeeding counseling services for the people we serve in those areas of Richmond. Rose, why were we established?
The literature is well represented in terms of breastfeeding, their benefits to the mother, to the child, to the family, as well as to the community.
And we launched the Breastfeeding Commission thanks to our mayor in July 2011, and it was really nice that everybody came together in Richmond. Bon Secours. Many people know I'm a board of trustee member for all of Bon Secours Health System International, based in Marysville, and HCA is here. Of course, VCU Health Systems with Valerie, and then Greater Richmond Chamber. We appreciate all the work that our men did and our colleague here from Richmond City Chamber, because it is a business case for healthy babies and breastfeeding. So we're happy about that, and glad everybody's here today.
And at that launch, Dr. Karen Remley, who was the health commissioner at the time, congratulated Richmond for being the first local government to establish a breastfeeding commission, and for being the first to bring together businesses, government, healthcare, and local advocates around this topic.
And our mayor is an example of other mayors around the country who've also taken this on. When we think of Mayor Bloomberg and other urban environments where we have high infant mortality rates, those mayors have stepped up to say, we need to do something, that this is one thing that we can do, not only to help our cities and our states, but also our country, and more importantly, to meet the Millennium Development Goals that the United Nations have put forward for women and children, and making sure no women die during birth and no babies die before age of 5. So the commission, many of the commissioners are here today, but you can see we have an exhaustive list of people who came to every meeting, really. And that says a lot about people, all of us, even if we had to get on planes or whatever it took. They worked hard on this, and so we celebrate them today. They are citizens of Richmond, and they took the challenge from the mayor serious.
And as we stated earlier, the group was quite diverse. As you see, not only was healthcare represented, but community activists, businesses, there were insurance companies, the faith community, and a prenatal yoga instructor, which is the first.
Very good. And so our charge from the mayor was to develop a breastfeeding commission for the city of Richmond, which we achieved, to increase breastfeeding numbers among women in the city of Richmond with an emphasis on underserved and fragile women, to develop and implement a comprehensive, multifaceted initiative that has been shown to have promise in increasing breastfeeding numbers in our city, and to develop an ongoing social marketing campaign designed to increase citizens' awareness and knowledge, including related resources regarding the benefits of breastfeeding. So what we're going to do now, I'm going to turn this over to Rose and our team of colleagues who, what we did was we divided out the expertise in different forums. And then we had our public forums. As you can see, we went around all around Richmond in all different areas and met with people who had a vested interest in breastfeeding, or maybe even met with people who were like, well, what are we doing this for? And so I think we changed a lot of hearts and minds, and I also think we gave people the opportunity to reflect and refocus what matters in Richmond. And if you want a strong city, you need strong families, and you need healthy mothers and healthy babies. So I'm going to turn it over to Rose so she can bring up the different members to talk about the recommendations that we'd like to present to the mayor today.
Our 4 recommendations are encourage health systems to adopt the 10 steps of the Baby-Friendly Hospital Initiative to achieve the 2020 Healthy People Goal. And recommendation 2, support and encourage Richmond City businesses to develop and implement a comprehensive lactation support program for their employees and their patrons. And recommendation 3, promote partnerships and education among care providers who come into contact with mothers, fathers, partners, and families before, during, and after childbirth, and during the infant's first year of life. And recommendation 4, develop education marketing strategy. So our first presenter will talk about the health systems, Valerie and
Again, my name is Denise Pacheco. I'm the lactation services coordinator for Henrico Doctors Hospital. I am a lactation consultant, a pediatric nurse practitioner, and also I am a doctoral student at UVA. So this particular project has been very near and dear to me because it's brought together everything in a whole 360 degrees to how what we do as community members, what we do as hospital care employees, what we do just in general to help breastfeeding has really made a difference for me. So,
To the,
sorry?
To this one.
to the left. There you go.
Okay, so the first thing we were discussing was about having our hospitals in the city of Richmond be baby friendly. And in order to do that, there are 10 steps which every facility that delivers babies, provides maternity care, has to basically be able to achieve in order to get that designation. The things that are most pertinent, I think, are the continuum of information that mothers need. Breastfeeding is not a one-time thing. It really is something that has to occur on the continuum. So being able to provide information to moms during their prenatal time period is a big influence, as well as being able to support them after they have their babies. Having a breastfeeding policy. All of our facilities are very vested in having a policy that not only tells what the lactation consultants think that we need to do for our moms and babies, but in general what our administration needs to do in order to be able to carry on through those 10 steps. Skin-to-skin contact. It is in our DNA as mammals to be able to breastfeed. Our babies, when they're born, their DNA says they will be breastfed. Mom's DNA says that they will breastfeed their babies. It's a biological thing. We don't have plant DNA and we don't have reptile DNA. So skin-to-skin contact is very important for our babies. As soon as they're born, we are the only segment of our mammalian population that separates our babies from the moms. Keeping the baby skin-to-skin, especially in the first couple of hours of life, is very important, as well as being able to establish and maintain breastfeeding throughout. Informing all mothers about breastfeeding benefits. That is very important, even from the time that our young ladies are getting into puberty, because it shouldn't be something that's considered an alternative, weird, or something that, oh, maybe I'll do it. It is natural. It is already in the DNA. There is nothing that we are going to ask mothers to do that their bodies and their DNA has not already programmed their bodies to do. Initiate breastfeeding within 1 hour of birth. That 1 hour is so important because the babies are making that transition from being fetuses to being independent people. And so basically, the best time for them to make that transition safely, for them to feel like they are comfortable at home, is to be able to try that in the delivery room with mom. Rooming in. We know that our moms and babies leave the hospital. They're not in the hospital 10 and 20 days. They're not in the hospital long enough to get those 240 to 360 feedings that the research shows that it takes for mothers and babies to feel comfortable, for the milk supply to be established. So rooming in, it goes a long way towards keeping moms and babies together so that they get more practice breastfeeding. No pacifiers or artificial nipples. While this might seem like a very benign thing to do, and we all know that babies have sucking habits, in the womb there is no pacifier. In the womb there's just the baby, and the baby has to make that transition. Keeping in mind that every time that we provide something artificial to our babies, that's less breastfeeding practice that they have. So that's one of the reasons why it is important to avoid those if possible. Encouraging health systems to support breastfeeding. We all come from different areas, different specialties, but right now we know that it's best if all of us come together and we're saying the same exact things. Nurses, physicians, obstetricians, pediatricians, social workers, that everyone should be all on the same page saying the same thing. And that really gives a consistent message that we are all behind each other and supporting each other on this. Working collaboratively with other health systems. I have thoroughly enjoyed working with other health systems because I am in my own little bubble sometimes in my facility, but I don't know what's going on in other facilities. So this was a perfect way for us to collaborate and find out, well, what's already been done. Let's not reinvent the wheel. We've already done this. Let's all try to do this. Let's all say the same thing. Let's all give the same information throughout so that we're not in competition. Instead, we're collaborating with each other.
Very good. While we get the committee to Valerie, anything you'd like to add?
Well, I only add that the recommendation she was making is for all babies, whether mothers choose to breastfeed or to bottle feed. Skin to skin is important. It's that connection. It decreases abandonment and abuse. for all babies, rooming in. Mothers actually get 47 extra minutes of sleep. If you keep the baby in the room, they learn the baby cues. So we take the literature and we want to use the collective impact. What's in it for me? We want to decrease disparity. We want to level the playing field for all our babies.
And Mayor, one of the things that we did here constantly throughout our meetings is that the 3 hospital systems really did enjoy this opportunity to work together and not be in competition. It was a beautiful thing to witness during this development.
Yeah, I think so too, because what we all know with the 3 systems, Richmond City residents, they go to all 3 systems. So it depends on the day and the time. So I think it was really good to bring everybody together.
And this next area, the business committee was very important, and which is why Chris is here representing the chamber, which is the largest business league in our community, because we know that returning to work can be a barrier for breastfeeding women. So one of the things we're recommending, Mayor, is that Richmond businesses implement lactation support programs. Here is a picture of the lactation room in social services, and another photo of that. And for those of you who may not know, we have 1 lactation room in this city hall as well. We'd like to establish, have you establish a 3-tier reward system for those businesses that will implement lactation programs. Just as in the Olympics, bronze, silver, and gold, depending on what degree you choose to do will determine which award they receive from you. And we will go through and develop some criteria to bring back to you for recommendations for that. We want to assist businesses. One of the things we don't want to do is for this to be complicated for an organization or something else, oh my God, something else we have to do. So we're going to develop the templates and the sample policies for them to use and for them to adopt, so that when we go in and meet with them, we can give them a boilerplate that they can use for establishing their own policies and continue to work with them throughout that process. And you know, we have a lot of special events that come to Richmond, and we're excited about that. And we want those events to also be able to say that they will provide a space for moms to breastfeed, or so that they can have some dedicated space just for them. And again, we would work with these venues to make sure that there's no additional cost to them. Bonsall Coors already has a mobile program that they take on the road. They rank the state fair. And so we already have them at the table, and they're willing to work with us in these regards. We don't want women to feel that they can't go out into the community or to events because they're breastfeeding. The Healthcare Providers Committee recommendations will be presented by Dr. Adepoye. Yes. This is the top one.
Well, our group was unique in that the healthcare committee consisted of nurses, community workers, physicians, and we thought, well, how can we improve breastfeeding? As physicians, when you have your patients, you make an important impact. So we realized that we need to start with the physicians who are in contact with mothers, not only mothers, fathers throughout their lives. And we also realized that in terms of health education, there was a big piece that was missing. The breastfeeding, you had it when you did your OBGYN invitation, but other specialties really weren't concerned about breastfeeding. So we thought it was very important to take that message to all physicians, nurses in different specialties that come in contact with mothers and fathers, before they get pregnant, during pregnancy, and during the first year of life. Also, we realized that as we looked into the literature, some of the materials that the physicians use in their office was a little bit outdated. And they didn't have breastfeeding as part of the teaching material during each trimester. So it was very important to make a recommendation to ACOG, that's the big body of obstetricians, to make sure that that teaching is part of every trimester. And being part of this committee, I was also part of reviewing our VDH forms, and so myself and Lorraine were able to send recommendations and actually change our forms. So our new forms now, we have breastfeeding the first trimester teaching, second trimester, and third trimester. So every mother gets an opportunity about the benefits of breastfeeding. So we have also been able to adopt a breastfeeding room. We have 2 breastfeeding rooms for our staff and for our patients that come. So we are breastfeeding friendly health district. Also, we thought it's very important to have doulas and lactation consultants. But we realized that most of the doulas were not being reimbursed. So we can have doulas and lactation consultants, but if the insurance companies are not paying for their services, most of the clients that we serve in Richmond will not be able to afford it. So it's also taking back the message to the insurance companies to reimburse for the services that they provide. As we all said, no, it's very important for all healthcare providers to work together with the social workers, with the case workers, with the insurance companies, with the pediatricians, so that they can provide care for the mother when she leaves the hospital, especially during those first 2 weeks, first 6 weeks, and then during the first year of life. So usually once the mother leaves the hospital, there's a disconnect. There's, who follows up the mother? She has problems. Who does she call? Does she call the pediatrician, obstetrician? Does she call the nurse? And so one of the things that we are working on in our health district is the home visiting nurse model that provides and follows up the mother during those first 6 weeks of life. And the response, of course, with the moms here, most moms have to go back to work in 6 weeks. So we also felt that it was very important to stress the breast pumps to be given to mothers who are going back to work, so that they can have access, so that all insurance companies would pay for the breast pump. So the mother, so there's no excuse that I can't afford a breast pump, that she can either get one through WIC or through her health insurance carriers. And Virginia Premier did some research, and Anthem, they provide breast pumps. But if all insurance companies could do that, it will go a long way to increasing the access to care. As I said earlier, it's very important, the doulas, lactation consultants, because they have more time to spend with the mothers. The physicians are in and out, but to really stress the importance of those extra community workers, lactation consultants, doulas, so that they're available for the mother during the first 6 weeks, during the first year of life, and also for the physicians, the obstetricians and the pediatricians to have a referral list, because you go into a lot of offices and they don't really have the resources in the community. So there's a disconnect. The doctor wants to refer to services in the community, but they don't know where to. So we thought it was very important to come up with a referral list to make sure that all OBGYNs in town and pediatricians can have a list of where mothers can go and get help. Most of you know about the WIC program. It's a women and infants that provide nutrition, and they do have breastfeeding care counselors, but we realized that for the city of Richmond, we only have 2. And so, we are writing grants to increase the number. And so, in doing some research, we realized that, wow, how can you have 2 or 3 for the whole city of Richmond? You need to do better. Those are, the care counselors call the patients, they have their, beepers. And so, we've written some grant work through the Virginia Department of Health to increase the number of care counselors.
And currently, they do not do home visits. Most of their counseling is done over the phone. And that's problematic.
It is problematic, because you need to go to the people's houses.
So if you're doing, a visit of breastfeeding over the phone, how can you really relate to what she's going through? So you really need to go into the homes. You really need that kind of program that you can see what's going on, how is she coping, what does she need, what's the next step, and really to show her. And then we also realize that a lot of young mothers, their mothers never breastfeed. So there's nobody at home to show this young woman how to breastfeed. So we really need to go back to the basics to do that. And also just really targeting women of childbearing age before they get pregnant, benefits of breastfeeding, right from when they become teenagers, to make it not, And once, just as an aside, we had the patient was breastfeeding in the lobby, and the guard came to meet me. She can't breastfeed. I said, no. VDH is a breastfeeding friendly health district. You can breastfeed. So, you can go into places and you're trying to breastfeed, and it's illegal to breastfeed. So I think health education to the community at large, that breastfeeding is a normal process. And in our community right now in Richmond, we're having more of the Hispanic population. And also we realize that in that population, once they come to America, they realize, we think, the best thing to give their baby is the formula. And so we're having to go back and re-educate that community that no, formula is not the way to go, breastfeeding. So we need more interpreters to really get into that community to do a lot of health education about the benefits of breastfeeding and that they need to continue the way they used to breastfeed in their country.
Lionel is going to give the community educators programs.
So by now you've probably seen that there's a lot of overlap in everything that we're talking about. And the community educators would be the folks that are seeing people after they leave the hospital, after they leave the healthcare system. But one of the things that's really important is that we develop a community that's supporting our breastfeeding mothers, because the moms can't do it by themselves. So one of our biggest recommendations to come out of that particular committee was to create a marketing and education strategy that would educate not just moms, because moms need the education too, but our grandmothers, our grandfathers, our business folks, just to make, again, level the playing field so that women are getting the support they need. We've talked about the possibility of using a number of strategies such as Facebook and Twitter, social media, PSAs, and we've actually explored and already priced out through the Richmond Health Action Alliance coalition that I'm forming through Richmond Healthy Start, looking at bus signs, because that goes to every portion of the city and can get the message out to a very broad population. So that was a big piece. To partner with existing breastfeeding groups and childbirth education groups. So LHAD would be one that already has several support groups that are meeting in the city of Richmond and outlying areas. The Virginia Breastfeeding Task Force would be a professional organization that we can access and partner with to get support and guidelines and recommendations. Text for Baby actually is a national initiative where you can sign up for it, moms can sign up for it at their particular level of pregnancy, and they get texts that are targeted to the stage of pregnancy or postpartum that they're at. So these are all sort of resources that we can have. There's also local doula groups and childbirth educators, all of whom, if we can pull into this network, we can create a stronger resource network for our moms and families. Developing a regional breastfeeding resource handbook and other materials in easily accessible and updatable formats to distribute to consumers and providers. So it's really important after they leave the hospital that they know where they can go and where they can find support. And we also want to be able to expand community breastfeeding educational forums to inner city locations and populations so that we ensure that there's inclusiveness. Right now they're not happening in the inner cities. So that was one of the things that we really wanted to make sure that resources are easily accessible by location. And again, you're seeing this repeated message of education. Ensure that all care providers, physicians, doulas, nurses, childbirth educators, anyone who comes into contact with mothers and fathers before, during, and after childbirth, receive breastfeeding awareness training at least once a year so that we have consistent messaging coming from everyone. That's you.
And then I just want to let you know that we did receive funding, and I want to talk quickly about two of them. In April of 2012, Richmond Healthy Start, in partnership with VCU School of Medicine, received a grant to engage the community in a project entitled Barriers and Facilitators to Breastfeeding Among Low-Income African-American Women in Richmond, Virginia. One of the things that we realized was missing, we just didn't have the time, was to hear a little bit more about mothers in their current situation. So we're conducting some community breastfeeding forums to hear the record from those women, and that information will be compiled into a report, and we will present that to you as well. And the HCAT that Leslie has been referencing, we received some funding from the Virginia Foundation for Healthy Use to establish the Richmond Health Action Alliance, which again will look at controlling and preventing childhood obesity. by promoting breastfeeding among new mothers and increasing physical activity among youth. And last year, we participated as part of a collaborative with Healthy Start and the Breastfeeding Commission and our 3 health systems, the Big Latch On campaign, which is a worldwide event, having mothers latch on at the same time, and you count the numbers and you report it in. So we had about 50 breastfeeding mothers at the time. That was our first one, but over 100 people came. And this year, Leslie, what's our count so far?
112 are signed up.
112 have signed up for the April 3rd event. Still going to be at the state capitol.
That's good.
So we believe that the recommendations that we put forth today will advance breastfeeding in the city of Richmond. And we also believe that our collective work will serve as a model for other localities that want to improve the health of their people.
Thank you.
Thank you for giving us this opportunity.
Very good.
I just want to thank everybody. And any questions? The commission for all of us.
I had a comment to share. The 2011 Surgeon General's report really is a paradigm shift in the way we look at breastfeeding, in that while we've acknowledged there's benefits for breastfeeding, we're now aware that there are risks associated for infants who don't receive breast milk. A 56% increased risk of SIDS, a 257% increased risk of hospitalization for upper respiratory tract infection, increased risk of diabetes, increased risk of obesity, increased risk of ear, nose, and throat infections. And so giving parents that information so they can make a truly informed decision about what they want to do.
And may I piggyback onto that? Not only are there health benefits or risks for not breastfeeding for babies, there are also risks for not breastfeeding for mothers. So when moms breastfeed, their cardiovascular health is better. They're at lower risk for cancer, breast cancer and ovarian cancer. And I think the recent study came out that says if we were breastfeeding to the Healthy People 2020 standards or goals, we were able to achieve that.
Exclusive for 6 months.
Exclusive for 6 months, we would save something like $13 billion a year in healthcare costs just for the mothers.
$19 billion for the infants.
These are great people to have on your
Yes.
board.
Yes. Well, one of the things we did think policy, so everything we did, we thought cost, quality, and access.
Yes.
So you're hearing that come through. Because we have to think about things that are sustainable.
Yes. And the one thing I'd like to share, Mayor, also is at the health department and other places, sometimes dads feel that they're left out. So we have a fatherhood initiative, and we let dads realize the importance of breastfeeding, but yes, they can actually share in that by making sure that she gets the proper rest, that she gets adequate nutrition, hydration, and after the nursing part is over, then that's your time to bond with baby, to change the baby, so that it becomes a family dynamic to support bonding, not just with mom, but with the dad, so that he doesn't feel like he's left on the outskirts of all of this, which is really important.
That's very important.
Yes.
Along with Prince William.
Yes.
Yes.
Exactly.
Yes, he will definitely not be drinking cows milk.
Yeah.
All right.
Thank you.
Well, thank you so much. This has been quite a report, and obviously the members of the commission are extremely knowledgeable. I got the feeling that we would not need Google if we had all of you around all the time with the information that you had. But we really want to thank you for the work that you've done. So Stephanie, Dr. Ferguson, and Rose, and all of the persons around the table, we want to thank you for the 2 years that you have worked on this initiative. I have to admit that when Carolyn Graham brought this to me a couple of years ago, I was like, are you kidding me? You know, but then it was an education for me, and your presentation about how natural this is and the benefits that are made available to children and mothers and eventually to the community. It really made me recognize that it was something that we really needed to do, and I think that education is extremely important because it's such a natural thing. It seems like it's the thing that was intended for us to do from our Creator. And so I want to thank you so much for the work that you have put into this. And Stephanie Ferguson, thank you so much for a job well done, and all of those who have put time into this, we're extremely grateful. You know, I like being a pioneer, and I like being on the cutting edge. I like being first, and so this has been an opportunity for us to step out and provide leadership for some other mayors in other cities, and saying that this is a great opportunity for advocacy, a great opportunity for someone to take the ball and really kind of take it down the court. And so I'm happy to have been a part of it, and if there's anything that I can continue to do to help advocate for this project, I certainly want to do it. Rose, how many lactation rooms do we have?
We have two. There's one in Marshall Plaza and there's one here.
Okay.
And I'll be working with the other departments to see what they can do to create space in their areas.
No, there are no other city agencies. I thought that.
The health department.
Well,
We
the
have
health
one for
department.
employees and we have one for clients to come in with, and they can actually also have the peer council sit on top of them and educate them while they're home.
And when we made the announcement of the task force, where was that announcement made? I thought there was one in that facility.
That was the one in social services.
That was in social
Yes,
services.
yes.
All right, very good. All right, so we need to increase that, and we want to continue to lead by example,
Absolutely, that's
by
right.
allowing other people to know exactly what they need to do in order to be like Richard.
That'd be great.
All right,
That would be
okay.
great.
And I found the secret to being a great mayor, and that is to get great people around the table who have expertise, who have interest. And I've also found that people who have passion about various subjects will give inordinate amounts of time in lending their expertise to find solutions so that we can move the ball forward on important issues such as this. So once again, I thank you so much for your service. Steve? Are we done? Thank you so much for wrapping that up.
Thank you.
And there are no questions because you guys have the answers. And so the people who have questions need to come and sit with you so that you can answer their questions. So thank you so much.
Thank you.
Make sure